Hello everyone, quick side note before we get to the video. I meant to upload this yesterday, so I say Sunday, Sunday, Sunday. It's Monday. I'm late, but anyways, enjoy the video. I apologize for my mistakes. Eh. Hey guys, so this week I decided I was going to make a video about how I do my T-shot now. So as I said in my last video, I switched from intramuscular injection to subcutaneous injection. The draw procedure is exactly the same. The only thing that's different is the injection site, the method of actual injection, and the size of the needle, both the gauge and the length. So the gauge of the needle is the thickness and the length is obviously the length. So I figured I still have leftover needles from when I did intramuscular, so I figured I'd show the difference between the two. So for anyone who does injections at all, your nurse or your doctor might have taught you about changing the needle between drawing up and injecting. So when doing an intramuscular shot, I did change the needle, not the syringe, but the physical needle, but purely for sanitary purposes and maintaining the integrity of the needle. Now, when I do subcutaneous, I do also change the needle, but that's because I still draw up with a much larger needle, but inject with a smaller one. So this is the needle that I would use for an intramuscular injection. It's, according to the packaging, 21 gauge and 1.5 inches long. I'm going to take the cap off, so I figured I'll put a trigger warning. If you don't want to see needles, don't watch this. So this is fairly large, as you can see, hence my anxiety about using it. Now, the needle that I'll be using to draw up my testosterone is this large compared to this guy. And then the best part is the needle that I will be actually injecting into me is only, it's terrible focus, is only this big. It's 5/8 of an inch long and it's 25 gauge. So a lot smaller and a lot thinner. It's a lot less daunting to look at, it's less scary to hold, it's less scary to do the injection. So all of that being said, exact same process. You're going to need your testosterone, your needle and syringe, your Band-Aid, and in my pocket I have my alcohol swabs. So as we all know, or if you've never injected testosterone, this is a how-to for you. Step 1 is going to be to sanitize your vial. Now when I do this even with a brand new vial, even if I'm just taking the cap off for the first time. I choose one swab, kind of give it a couple swipes, and I leave it on top of the vial while I prepare everything else. So my current dose is 0.25 milliliter of 200 milligram per milliliter, per liter concentration. So I'm getting 0.5 milligrams of testosterone in 0.25 milliliters of solution. The first, or I guess we're past the first step, but the next thing you're going to want to do is draw the respective amount of air into your syringe. The way these vials work is they're vacuum sealed. So you have to displace the liquid that you are removing with air. So my dose is 0.25 milliliters. So I pull my plunger back and I get it set right on that line. The next step is to take your needle into your vial, flip it upside down, and inject all that air. And then draw up your dose. The hardest part about drawing up testosterone is the fact that it's so thick. It doesn't really want to draw with your plunger Sometimes I have to do multiple plunges, if that makes sense. But I typically pull the plunger back a lot further than I need it and wait for the solution to fill the syringe. So after that is done, you're going to want to double check that there's no bubbles at all in your medication. I say at all, but tiny bubbles aren't going to hurt you. They're not going to kill you. You're not injecting into your bloodstream. However, large enough bubbles can displace the amount of medication that you're trying to take in. So you really want to make sure that there's no space, essentially. So after I draw my dose, I put the safety cap back on the needle. And before I open up or remove this needle, I like to get this one prepped so that I don't have an exposed syringe hanging out before I have to put the medication into my body. So once again, this is a 25 gauge, 5/8 of an inch needle. I'm going to try and do that Beauty Guru thing where you hold it up. Yeah, you can kind of see. The needle is only this long. The cap goes all the way up to here. It doesn't even fill half the cap. So like I said, it makes it a lot less daunting. I try not to touch the needle. I open it very gingerly, and I cautiously change them. I always spin the needle that I will be injecting with on very snugly. My doctor never really spoke about it, but I'm worried personally about extra air getting in or the needle possibly coming loose during injection. It's never happened to me, but I like to eliminate any chance of error because, like I said, during intramuscular injections, I have had a couple mishaps, and that has given me a lot of anxiety, but the best way that I deal with it is knowing that I have all of my ducks in a row, and I know that I do all of my steps right. And I suggest that you try to be very conscious about what you're doing and very purposeful in your actions when it comes to doing something that makes you anxious. So the next step, another alcohol swab, is you're going to want to prep and clean the injection site. So I'm going to stand up for this. Your intramuscular injection goes into your thighs. I've heard of guys doing them in their gluteal or other muscles. Subcutaneous is going to go into this fatty tissue on your tummy. Now, the way I was taught is around 2 inches away from your belly button in any direction. You're going to want to take a little pinch, insert your needle at a 45-degree angle, and then slowly but forcefully inject all of your medication. I was taught that these are 4 quadrants. It's going to be reversed for you, but upper left, lower right, upper right. And they say to circulate throughout these quadrants so that you don't have a buildup of excess scar tissue in any one particular area. All of that being said, I believe my next quadrant is my upper left. My nurses and my doctors suggested creating a little log or keeping a journal or maybe even writing it on the box that my T-vial itself is in so that I don't mess up my rotation. However, I haven't really had many problems with that. I tend to remember. Another tip that I was taught for stomach injections was tucking your clothing into your binder, or if you don't wear a binder, take it off. They also told me I could lay down, I could sit down, I could stand up. I'm standing up right now to show you where I do it. However, when I physically do my actual injection, I will be sitting down. Like I said, no air in the syringe. And when you change the needle, there is a bit of air in the top up here. So I tend to push my medication through until I see a droplet at the tip, and then I inject, because I don't want this air in my body. So like I said, around 1 to 2 inches away from the belly button, take a little pinch, 45-degree angle from your body. And just inject it. You're going to remove your needle, cap it safely, dispose of it in a sharps container, and put a Band-Aid on your injection site. And just like that, you've done your shot. Now that I've done it and I've shown the process, and I can put the link to my intramuscular how I do my shot video in the description, I just want to talk about the pros and cons personally for intramuscular versus subcutaneous. So, like I said, the biggest one is the size of the needle for myself. After essentially causing harm to myself with the much larger needle, the smaller one is a lot easier for me to look at and handle and not feel inept, if that makes any sense. One of the only cons really that I have is the fact that the hormones are absorbed a lot differently in fatty tissue versus a muscle. So I have not had my dosage changed since being switched to subcutaneous. However, I am up for blood work and a probable dosage change this month. When that comes, I will do an update, but my doctor did say that it's absorbed a lot less efficiently almost. Similarly to how the gel is absorbed differently topically than, once again, injecting it into your muscle. As far as my experience being on a subcutaneous injection, previously I was not consistent with my shots because I was scared, to be flat out honest. I wasn't consistent. So I am not really the best gauge of the speed or depth of changes with intramuscular versus subcutaneous. However, I can say that since being less anxious and being able to physically do my shot a lot more regularly, I've now been regularly doing my injections for about 2 or 3 months. Very hard scheduled regular every Thursday during the evening. I can say that, now I'm starting to get my facial hair growing in more consistently, and my voice is cracking again, and my body hair is once again growing more consistently. So none of these changes stopped for me while I was having trouble with the consistency of my hormones, but they were slowing down or sporadic, and that made me dysphoric. So I had to do something about it, and my doctor suggested a myriad of methods. Apparently they have a testosterone nasal spray now, there's a pill you can take, there's an implant you can get that works kind of like the birth control implant that goes in a person's arm and just stays there for a couple weeks or months depending on the medication. But ultimately, for myself, an uninsured person, just changing the method of injection was the cheapest and most practical solution. I've definitely talked way too much and repeated myself a million times. So with that, I end this video. If you have any questions, any comments, anything you want to know about, anything I didn't mention, or even any mistakes I might have made, just leave a comment down below and I try to respond as best as I can. I'm not famous. I have probably less than 50 subscribers. I think I got 6 views on my last video, but I'm out here trying. So like I said, leave a comment, like this video, subscribe if you want, and I'm going to try to upload every single Sunday. Thanks so much for watching, and I'll see you next Sunday.